Thank you for inviting me to speak. I have no disclosures related to this talk. The first time I experienced the stigma surrounding lung cancer was almost 38 years ago when my dad died of lung cancer at 41 years old. I was out with some friends after school, and one friend asked me why I was never in a good mood anymore. I said, "My dad just died." My friend's response, "Well, my mom said it was your dad's fault because he smoked." Suffice to say, the emotional scars and the impact that left on me at 13 years old are with me forever. I continued to experience the same stigma in my 20s when my mom and my aunt died of lung cancer. And when I was diagnosed with lung cancer 12 years ago, sadly, I was already used to it. But to see my kids experience the stigma and knowing firsthand how painful it is has been heart-wrenching. No other disease is stained by the blame culture like lung cancer. In fact, every other cancer diagnosis elicits empathy with responses such as, "I am so sorry," or "What can I do to help?" Pure sympathy with no blame attached. But for most of us living with lung cancer, the very first question we are asked is, "Did you smoke?" Regardless of someone's smoking history, those three words have real consequences and are linked to distress, depression, decreased hope, and poor quality of life. And I know from personal experience that those three words can be devastating to family as well. None of my friends who lost parents to various cancers were asked if their mom or dad did something to deserve cancer and die. For a long time, I was angry at my parents and blamed them for my suffering, which is a heavy burden I still carry. And the three words, "I didn't smoke," are just as damaging. And they are dividing our community into two teams, the innocent versus the guilty. I know it sounds like a harsh analogy, but it's actually a harsh reality. Think about it. When someone is forced to heavily emphasize and say, "I didn't smoke," the message being sent to the 85% of patients who have any kind of smoking history is, "You are the ones that deserve lung cancer." While I know that's certainly not the intention, unfortunately, the impact of that message is profound and wide-reaching. From media, government, and physicians down to the individual, biases and stigma are so pervasive that it affects both a patient's health-seeking behavior and a physician's perception of a person with lung cancer. And while overt examples have obvious consequences, the subtle, unintentional biases can be just as damaging and dangerous. I have a brother who's 18 months older than I am, and he's been rolling and smoking his own cigarettes since he was 16 years old, but he doesn't have lung cancer. When friends, fellow advocates, or physicians hear about my brother, I get responses such as, "Aren't you angry?" or "How did you get it, not him?" But the one that really upsets me is when people say, "Well, that doesn't seem fair." Since when is life fair? No one, including my brother, deserves lung cancer. The physical and emotional pain and stress of facing a lung cancer diagnosis is enough. No one should be made to feel shame, guilt, or have to defend themselves or their loved ones for getting this insidious disease. Cancer is complicated. There isn't a simple cause and effect. Yes, smoking is a risk factor for lung cancer, but science has identified many other risk factors as well. Yet the overwhelming "lung cancer is preventable" message remains a deadly problem, and it creates barriers to diagnosis and care. It also prevents research and awareness into all the other risk factors of lung cancer, which leaves the public with a false sense of security that if they don't smoke, they won't get lung cancer. I know the public health campaigns aimed towards smoking cessation are important and have been successful. That can't be minimized. But we must recognize that they have led to the unintended consequence of stigma, which is just as harmful and is not being addressed. And I want to note that taking a person's smoking history is important for cancer treatment, but it must be addressed as an addiction, which is a disease, not a behavior or a moral failing. The direct effects of words and how they are communicated the direct effects that they have on us must be considered in conversation. There will always be a stigma if we patients are defined by the stigma, by our smoking status. Referring to patients as a smoker, former smoker, light smoker, never smoker is negatively labeling us. It doesn't tell the whole story of who we are and everything else about our lives. Beyond the label, we are people, moms, dads, children, siblings, friends, people who have dreams, wishes, talents, and people who also make important contributions to society. Now, I know medical language is rooted in tradition, and historically it was used to describe cancer. But over time, many of the words, descriptor, and phrases have become stigmatizing, degrading, and harmful. Like research and treatment, the language we use needs to advance, to evolve, and be more empathic and non-judgmental. And because of that need, the ISLAC language guide was created to provide best practices when talking or writing about lung cancer. The use of person-first, stigma-free, blame-free, equitable, and inclusive language is an important step in the ongoing process of increasing respect and unity throughout the entire lung cancer community. But our hope is that it extends beyond that. The pain from watching someone you love suffer through the cruelty of lung cancer until their last breath is unbearable. So does it really matter whether or not they smoked? Does it mean they deserve to die? Does it minimize the loss? Or do those left behind deserve less sympathy? It doesn't matter. What matters are people. Using words that help, not hurt, matters. Empathic, guilt-free care and acceptance in the community matter. And the perception of lung cancer won't change unless we stand up, speak up, and act to change it. Now is the time to make a conscious commitment to changing our own thinking, actions, and the conversation surrounding lung cancer. Only then can we educate others, kill the stigma, and save lives. Thank you.